Good morning, afternoon, or good night to everyone joining this session. This is parallel session number 5. I'm delighted to see all the panelists between us. So we have an hour to go to this session. Each panelist will have 10 minutes to present. At the end of the session, we will have opportunity for questions. So I will ask you to please reserve your question to the end of the session. And we have an order of panelists presenting today, and you can see that order in the agenda for the conference. My name is David Rojas. I'm a professor at Colorado State University on environmental health, and I will be chairing the session. So again, thank you for joining. And because we have a very limited time, and I want the panelists to be able to present and use maximize their time. So I will be starting with the first panelist, and we have Martine Shareck. Please, if you want to start sharing your screen and introduce yourself. Thank you.
So, hi everyone. Can you see my screen?
Yes.
Yeah. Okay. So, good morning, everyone. I'm Martine Shareck. I'm an assistant professor in community health sciences, and today I'll be talking about urban revitalization and well-being among young adults. So, as most of you probably know, neighborhood revitalization or renewal generally involves making physical, social, or economic improvements to neighborhoods that are characterized by relatively higher socioeconomic disadvantage. These changes may include improving housing and other buildings, building parks and public spaces, and improving aesthetics. Some studies have shown that there may be positive impacts on things such as sense of belonging to the neighborhood, feeling of safety, and mental health and well-being. But there may also be a dark side to revitalization. So negative impacts may include social network disruptions, social exclusion of certain groups from the new spaces that are being built, and population displacement and gentrification ultimately. Such hypothesized both positive and negative impacts may also not be felt equally across social groups defined by gender, socioeconomic position, and ethnic background. So the study I'm presenting today takes place in Sherbrooke, which is a mid-sized city located in Quebec, Canada. The city has seen massive investments being made to revitalize its downtown core. What's important to say is that the downtown area is quite small, so it's about 1 square kilometer, and 93% of residents are renters, and more than half live below the poverty line. There's many nonprofit and community services that cater to marginalized populations and to young people that are located downtown. So the entire downtown is bound to be revitalized, with one specific project on Wellington Street, which involves $80 million in investments, 25 million of which are from public funds. This money will be used to build 2 large towers to house residential, office, and commercial spaces, to build a new public space and bike lanes, and to improve street aesthetics. There's also a large parking lot that's been built. So these changes might heavily influence both positively and negatively the health and well-being of downtown residents, and this is what the Centré study is focused on. So the Centré study is a mixed methods longitudinal cohort study, which aims to evaluate the impacts of the Sherbrooke downtown revitalization on health and health inequalities among 16 to 30-year-olds. As part of Centré, we have a qualitative arm which aims to explore downtown residents and users' everyday experiences of the neighborhood, as well as its impact on health and well-being. We're also exploring potential differences in experiences according to gender and occupational status. So for this qualitative arm, we conducted 20 photo-elicited, go-along, and semi-structured interviews with downtown residents and users at the very beginning of building work. Interviewees were drawn from the survey sample, which encompasses 1,470 participants who live across the entire city of Sherbrooke. So more specifically, we invited interviewees to take us on a walk through their neighborhood, so that was mainly downtown, and to take pictures of aspects that they thought influenced their sense of belonging, social connections, and well-being. They then took part in a sit-down interview where we discussed the photos, things we had seen during the walk, and asked interview questions. So the plan is to perform a thematic content analysis of interview transcripts, field notes, and photos to identify patterns of meaning for young adults' social connections and well-being across interviewees, as well as between social groups. We've encountered a few delays with the data analysis, so today I'll be discussing preliminary observations. So the interview sample was 60% women and 10% identified with a different gender identity. 50% of participants were in full-time work, 10% were students, and 20% were not working or studying. And 90% of the sample was of Caucasian background, and this distribution in sociodemographics is similar to the larger survey sample. So since the baseline interview data were collected when the revitalization project wasn't super concrete or clear in everyone's minds, some people shared just general thoughts on the downtown area. So people appreciated the proximity and accessibility to natural spaces, including green and blue spaces, since Sherbrooke is at the confluence of two rivers. They thought such aspects of being close to nature really benefited their well-being. On the other hand, concerns with safety were also common, especially among women. There were specific places to be avoided at specific times, such as close to parking lots around dark. So although these findings do not relate specifically to the revitalization project, they can help inform interventions, such as making sure that the green and natural qualities of downtown are not disrupted by the revitalization efforts over the years, and ensuring that outdoor lighting is adequate to improve feelings of safety. Participants also had a lot to say about the revitalization project per se. Interestingly, references to health and well-being were not always explicit, but participants referred to the wider social determinants of health quite intuitively. Participants also expressed a combination of optimism and pessimism regarding the project. So as this quote suggests, despite the building work being quite noisy and annoying, the opening of new public spaces and patios and improved aesthetics were said to bring joy. On the other hand, a major concern was expressed regarding housing affordability and its corollary, displacement of less well-off residents. There were already horror stories of reno-eviction made by private contractors, so contractors evicting tenants for renovation purposes, which led to unaffordable rent increases. And these caused a lot of stress and anxiety among participants who thought the downtown area was in dire need of social and public housing. The potential closure or displacement of essential social and community services catering to more marginalized groups, such as homeless shelters, mental health services, and secondhand stores was also of concern. So this is just a quick overview of preliminary observations and themes that came up in our analysis. But the next steps for this project will be obviously to do a more fulsome thematic content analysis, so stay tuned. As next steps, we'll also be launching the follow-up survey and interview data collection in the winter and spring 2023. So as part of Centré, we plan to collect 3 data points in total, and this longitudinal data will really be interesting to analyze since, as been said before, sometimes outcomes in complex contexts such as this one might get worse before they get better. So collecting our 3 waves of data will really allow us to see how things evolve over time. So while we work on the full data analysis, there are a few points that merit discussion. First, the go-along method itself proved extremely rich and valuable. In general, this approach values experiential knowledge and allows us to reduce the hierarchy between researchers and participants. Participants here were very much appreciated this method, and they were really proud to show us around the neighborhood and teach us things that we didn't know necessarily about their neighborhood. It also seems like the positive and negative impacts of large revitalization projects can be anticipated and felt early on, even before the bulk of changes are made in the built environment. So knowing this really is an opportunity not to be missed, to build on existing strengths, in this case, nature and aesthetics, and address potential challenges such as those related to rent increases, social housing and lighting as soon as possible. And one way to do this might be to act with city officials and promoters right away. And finally, in this study, we interviewed mostly residents, but also users or visitors of downtown, so people who studied or worked downtown. There seem to be differences in concerns and anticipated impacts between residents and visitors, but this was hard to explore. So in the follow-up data collection, we'll be expanding our sampling frame to accommodate this. So just to sum up, tapping into people's daily experiences of their changing neighborhood can really help shed light on intricacies and nuances, which might be harder to grasp with quantitative data. We hope our findings will help inform the design of potential solutions to limit the negative impacts of revitalization on well-being and inequalities. So I thank you for your attention, and please do get in touch if you have any questions or want to come work with us. Thank you.
Thank you so much, Martine. Fantastic intervention and project. So I have a lot of questions, but I will reserve those for later. So the next presenter will be Bachera Aktar. Bachera, if you're ready to start sharing your screen.
Thank you, David. Good morning, everyone. Let me share my screen. Hello, everyone. I'm Bachera Aktar. I work with Bragg James Spriggan School of Public Health as an assistant director, and I'm also a PhD student currently at Liverpool School of Tropical Medicine. And welcome you all to today's presentation. So this is the overview of today's presentation. I will briefly share the background of the study site and the study objectives, and also about very briefly about the project I'm currently working with and the methods, some key findings, and finally a conclusion. So like many other developing countries, rapid urbanization is happening in Bangladesh, and mostly due to the rural-urban migration, and people living in the rural areas, mostly they migrate to the urban areas in search of better livelihood and living condition. But unfortunately, those people end up living in informal settlements in the cities because they cannot afford proper housing in the cities when they move to the cities. So 1.5% of the total urban population in Bangladesh live in the cities. And most concentration of this of the migrants who move to the cities are concentrated in Dhaka city, which is the capital city of Bangladesh. And 1/3 of the Dhaka city population lived in more than 3,000 informal settlements. But unfortunately, those settlements are not recognized, and they're considered as illegal, and therefore they are left out from the government policies and city development plans, which which limits their access to basic facilities and healthcare services. So in the ARISE project in Bangladesh, we are documenting the vulnerabilities that the poor people living in those settlements face due to the urban planning and also the development which are happening in the urban areas in Bangladesh, and the impact of those development-induced vulnerabilities on the people living there. So the ARISE Hub is a global consortium. It's a research consortium. It stands for Accountability and Responsiveness for in Informal Urban Settlements for Equity. And our overarching aim is to catalyze state changes for improving social accountability and promoting equity for well-being, health and well-being of the marginalized people living in informal settlements in 4 countries. So we work in 4 countries with 11 partners from Global South and North. And this project started in February 2019. And this project is funded by UKRI. And these are the 11 partners of this project. And in Bangladesh, we work in 3 cities and 5 informal settlements. And among these 3 cities, 2 cities are climate affected. And we are working with the marginalized people living in informal settlements. And we do have a community mobilization partner, which is Bragg Urban Development Program. So these are the methods that we are currently applying in our research. It's a multi-method research. We apply community-based participatory methods and also household surveys. And during COVID, we conducted one rapid research through phone interviews as the movement was restricted in Bangladesh at that time. And today I will be sharing findings from one participatory method, which is photo diaries. So photo diaries is a very useful method and tool applied when people with the marginalized people, when they cannot actually share their experience, because they don't have voice. So the photos are very strong evidence to share and express their sufferings, share their experiences, and also share their demands that they want to share with the governance actors and with the wider policymakers. So in the photo diaries method, we first identified different thematic areas in consultation with community researchers. So in our project, we recruited community researchers, which we called co-researchers from the community. They live in the community, they're part of the community, but they're also part of the research team. So we identified different thematic areas, for example, different types of vulnerabilities community people are suffering, the situation in the lockdown, COVID-19 related support and management, and also different community-led initiatives. Then we trained the co-researchers on how to take photography, research ethics, and also different thematic areas that we identified. Then the co-researchers captured photos, and they also shared photos and narratives in a WhatsApp group. And we conducted this method also during the COVID restrictions in Bangladesh in 2021. And then the academic researchers analyzed the preliminary findings, and we transcribed the voice and written messages that we received from the co-researchers on WhatsApp group. And we identified also the issues that we need more clarification from the co-researchers. Then we arranged a reflexivity station where we and co-researchers co-analyzed all the photos and narratives, and also discussed other emerging issues that come up from the photos and narratives. So here you can see the glimpse of some of the photos and narratives our co-researchers shared with us. So one common development and induced vulnerabilities came up across all the sites are that waterlogging and flooding. And because the reason of this waterlogging and flooding is basically the improper drainage system and also improper waste management in the cities. And this quote is from the female co-researchers from one of our sites in Dhaka city, which is Kullanpur. And the same also happened in Dholpur site, which is mostly the resident city corporation waste collectors lived in that specific settlement. And similarly, we also have found the same problem with waterlogging and flooding in Shampur. The Shampur is a very low-lying area, which is at the bank of the river Buriganga. And also there are many small industries, small and big industries near that settlements who they actually dumped wastewater, industrial wastewater in the water bodies just close to the settlement. And the settlement are mostly the floating houses above the industrial water waste. And in Dholpur, although the city corporation waste cleaners live there, but one of their main problems is waste disposal. So there are the city corporation has reallocated their workers in 5 10-story buildings, but there is no proper waste disposal and waste collection system there. As a result, which results waste overflow on the road, and the problem become worse during the rainy season. And you can see that in this picture, when we look at this picture, we can, one question may come to our mind that there is a road construction happening and how that can be a problem for the people living in those settlements. But our co-researcher shared with us that they have a fear that once the road is constructed, the government will acquire the land and government will demolish the settlements because the settlement is established on government land. So they are afraid of eviction, although this kind of development, this kind of infrastructure development will help them to link with the local market and local economy, but that at the same time, they're also afraid of losing their housing. And so to sum up with all the findings that we have found from the photo diaries, that there are vulnerabilities which caused by improper solid waste management, poor drainage system, and also poor industrial waste water management, which lead to overflow garbages and also water, which result in waterlogging and flooding. And tenant insecurity also increase their fear of eviction. And as a consequence, there are waterborne diseases. They have difficulty in movement, and during rainy season, when the roads are flooded and their houses are flooded, that also hampered their daily life, their income, and also the education of their children, because the children cannot go to school. And also that causes environmental pollution, which is also leading to other health related problems. And the eviction, because of the eviction, they lost their house and income. The overall, it affect and impact their overall health and well-being of the dwellers. But they are not actually sitting idle. They're trying to solve their problem by themselves, because they don't have, or they don't get support from the city authorities, so they take their own initiatives. And in this photo, one of the co-researchers from Kollanpur, they shared that how the community tried to solve their water scarcity problem by themselves. So they pooled their money, they tried to maintain and repair the pipelines that was damaged. So but that way they tried to solve their problem in their community. So to sum up, that the settlements in the cities, they're excluded from the city development plan, and which create more vulnerabilities and intensifies their existing one. And city corporations and city authorities, they're less interested and not taking initiatives properly, because those settlements are illegal, and they don't have legal identity, because they're built on either vacant public or private land. And so we need comprehensive urban planning, and we need to include those settlements and the dwellers in the planning process. And that is very crucial for their development. And if you want to know more about our project, there are some information about that. And we also acknowledge our funder. Thank you, everyone.
Thank you so much, Bachera. This is a fantastic project too. So very interesting activities, and I'm glad to see these communities to be captured with this project. So if you have any questions, please wait to the end of the presentation to ask questions. So our next presenter is Chirag Sharma. If you want to start sharing your screen,
I'll
please.
share my screen. Yes. Is the screen visible?
It is. So if you can expand your presentation and full screen.
So good morning, all of you.
Yeah.
So today, myself, Chirag Sharma, undergraduate student at the Department of Architecture, National Institute of Technology, Raipur, and along with me is Assistant Professor Sayon Pramanik, sir, who is also at the Department of Architecture, National Institute of Technology, Raipur. We are presenting on the topic of role of public parks and spaces in creating age-friendly cities. So the problem with the developing nations of global south is that due to the rapid urbanization, rapid urbanization and rural to urban migration, we see that there are many multivariate problems existing, almost coexisting at the same time. So in order to address those more important problems, certain subtle problems such as the problem of active aging goes unnoticed. So due to the lack of means and methods of assessing and measuring the active aging index in the developing nations such as India, we see that there is no action being taken on in this domain. So in India, we see that mostly people migrate from rural to urban areas in search of better livability, in search of better jobs, in the search of improving their quality of life. So due to these existing problems, what happens actually is they get in a loop of a rigid urbanized life. So therefore, in the tier 1 cities of India, this is a very big problem. So the problem of active aging is also directly related to the problem of urban well-being, which directly determines the quality of life. Although there have been certain suggestions by organizations such as UNICE and WHO as well in the recent times, they have published an active aging index for the non-European countries, which targets, which directs certain guidelines, which define the parameters through which we can assess and determine the quality of aging in the inhabitants of the urban areas. So in that, the major the parameters which hold the most weight are physical and mental well-being, along with other social parameters, which include socio-economic well-being as well. So due to the lack of a dedicated and a systematic means of measuring active aging indices in India, we see that at policy level or at design level, there is no intervention which directly addresses this problem. Although the quality of life is being addressed through certain projects like introducing introducing certain like well-being areas in the urban areas. So the notion of age friendliness and the notion of active aging is to make the cities more equitable for the people. So the methodology that we adapt in order to assess and define a very systematic process through which we can go for the urban form assessment of the cities, of the tier 1 cities of India, which can be considered as a top-down approach, and a pedestrian approach, which can also measure the walkability as well as the catchment areas of public parks, depending upon the comfortable walking distance of people from different age groups. So that can be counted as a bottom-up approach. And through this, we are proposing a methodology in which we can account for the active aging in tier 1 cities of India and to some extent developing nations as well. So the selected cities that we take are Mumbai and Kolkata. The reason being they are the most populated cities of India, and they are also the cities where we can find there are different categories of public parks. There are different types of public parks available. So we can have a varied data set through which we can assess and determine the role of public parks in active aging. So the urban form of the cities looks somewhat like this. So in Mumbai, we can see it's a very linear kind of development, and in Kolkata, it's quite different. So if we, in order to assess through certain parameters in the bottom-up approach, taking in account the pedestrians' perception and the pedestrians' comfort for walking distances, we did certain public surveys in both the cities through online means, and we determined certain parameters which considered average comfortable walking distance for different age groups of people, proximity to a public park from their respective residence, and accessibility of a public park or space, again, either through walkable access or through their own private or public conveyance, and the catchment of public park or space. So this is the selected areas in Kolkata. So the red dots that we see here are the entry points into the various public parks and spaces in the city. And in the 4 different selected areas, what we see is in the region over here, this is called the Maidan area, which is also close to the famous Victoria Memorial, which is a very common tourist spot in the city. So this has a natural catchment of more pedestrians and more people. Therefore, we will see in the catchment analysis over here, we see that the public parks and spaces are intertwined in such a way that the surrounding residential areas are somewhat permeable, and these are the comfortable walking distances for the pedestrians to the parks and to the public spaces. Again, the same we can see in the in the Salt Lake area. We see that the public parks and spaces are intertwined in the residential spaces as itself. So the catchment is comparatively more, even though there are no big public parks. There are no large open spaces apart from the central park, which is at the center. Therefore, we did this catchment analysis in 4 different radii of walkability for 400 meters, 600, 800, and 1000 meters. So these values were reported to us in the through the public surveys, in which the people deemed it comfortable for them to be a good walkable distance. So in the Medan area, we can see that even though there is a large public park, the catchment is quite less. And in the Salt Lake area, we can see that even though there are smaller scattered public parks in the residential areas, the catchment is almost the complete block is accessible through comfortable walking from the residential areas itself. We can also see an example of the newly developed Eco Park area, which is a dedicatedly developed public park and space, which is only having a very meager catchment of pedestrians. Therefore, the only means to access that place, apart from the local people, is through either public transports like bus and taxis, and through their own private conveyance. This shows us 3 different levels of network analysis, in which we do the mean depth, the local connectivity, and the global choice analysis, which tells us the local like the mean depth measure tells us how many turns do I need to take in order to arrive at a public park. The local connectivity tells how connected is the particular space to the residential areas, and the global choice tells it takes a holistic, it takes a complete analysis, a complete network analysis of the city. So here we can see that in the Medan area, although because of its openness, we can see that the mean depth is quite less. And in the Eco Park area, which was having a lesser catchment, it has a more mean depth. So this is a contrasting example which we can see in through the network analysis of space syntax. So in the local connectivity also, they are they comply with the catchment analysis data. And the global choice analysis tells us that all the major roads connecting to the 4 different selected areas, they are accessible by public transport and the private conveyance as well. So in Mumbai, we also did some selected study, and through this, we also determined similar areas. Like here we can see in the Juhu Chowpatty area, which also has a marine drive connected to it. There's a series of public spaces, which although it is not a public park, but people use it for morning walks and evening walks, and for other social conventions. So although it is a famous public space, the catchment area is very less. And in the sports grounds and parks in the other areas of the city, we see that again the location of local parks, smaller public parks, which are permeated into the residential areas, creates a bigger catchment area, which is also visible in the playgrounds and local parks of other 3 examples as well. In the space syntax analysis, we get quite similar results to what we got in case of Kolkata, in which we can see the mean depth in the lesser catchment areas is generally more, and the local connectivity is also more. But the global connectivity is only through the only through the major connecting roads. Therefore, they are not very accessible by the general public of the city. So in conclusion, we can say that local parks play a pivotal role in increasing walkable catchment as well as interlinking the catchment area of other intermediate parks as well. So we can see that in whichever analysis, there was a smaller public park located in between two other public spaces. It increases the catchment area of the pedestrians, and therefore it engages the pedestrians more into the public parks and spaces. This was confirmed through the survey, through public surveys, through which we got to know that the factors of time and distance are vital in the urban areas. Because of the rigid life, we need to have this experience in a shorter time, and the distance to the parks, the proximity should be less. So many of the respondents also responded back that although they would like to visit a public park in order to improve their well-being, they were not able to do so because of the time constraint, or either they were not able to access the public park from their place of residence. So we found in conclusion that the relation of public parks with active aging in case of developing nations such as India it can be a dynamic model which can tell us through public surveys we can identify urban well-being indicators which can again help us verifying active aging. And the permeability of public parks depends on two crucial factors of time and distance, which define the user priority. Therefore, although the public parks might have a more catchment area, or they might be located in a central, well-connected region of the city, their park equity might not be equally good due to the reduction in user priority, or uh, maybe due to the constraint of time and distance, or the constraint change as we have seen in the public surveys. So that tended to reduce the park equity, and that indirectly affects the active aging factor of the city. So this study was conducted through open source GIS tools, and through QGIS and OpenStreetMaps, and the space syntax analysis was conducted through DepthMapX, which is also an open source tool. We would also like to thank the undergraduate students, Mr. Soham Banerjee and Ms. Kajal Kabdal, for their contribution in the conducting of online surveys and validating the study. Thank you.
Thank you, Chirag. Thank you. I think we are over time, so thank you. So,
Sorry.
yeah. Can you stop sharing? Thank you. Very interesting. Thank you for sharing those. So we have, well, like a 20-minute left, so we don't have a lot of time for ending questions probably. I will try to be fast now. So I'm the next presenting, and I want to allow Nimish to also have opportunity to present. So my name is David Rojas. I'm a professor at Colorado State University. I will be presenting you a tool that we'll develop for the Colorado Department of Public Health and Environment, the Colorado EnviroScreen tool, an environmental justice mapping tool. So a little bit of what is a Colorado EnviroScreen. So this is an interactive online mapping tool that offers, in this specific case, the state of Colorado, a vision of demographic, environmental, and health information to try to identify the potential locations, geographical distribution of environmental injustices at the state level. So, and this is what you can actually visualize. This is an online tool that is open access, freely to access. It's active if you Google Colorado EnviroScreen. You can find that online, and you can play with the tool. So the tool is in English and Spanish and offers you a map of the state of Colorado. That is what you're visualizing here. The different colors highlight the different areas in the state and provides a contrast between those that could suffer more environmental injustices based on a composite index. In the darker areas, we expect to have a higher score, in other words, more environmental injustices. And the lighter areas, you have information that shows less environmental injustices. The tool also offers a histogram that provides a distribution of those scores across multiple locations in Colorado. So users can click in the specific location and compare themselves with the rest of the state and see how good or bad are performing in this type of scoring methodology. So the key factor here is that this type of tools that exist offers the combination of three main topics. One is the human health impacts related to environmental risk factors. The other is the environment itself, includes environmental exposures, and even places that often are related with emissions. That could be oil and gas activities, waste management facilities, and environmental justice. Environmental justice refers to those indicators that provides a characterization of the social demographics in the community. So the purpose of the tool is to help reduce environmental health disparities in the state of Colorado. So the intended user of this tool is everyone that works, study, plays, lives in Colorado or visit the state. So it's a tool not only made for the state agencies or the government, but also for the city authorities, local civil society organization or community-based organizations, community members that just want to see and type the address and see how the score is in their location, so they can even go and see the address type of value. So some important questions that we should think when we are developing these tools and we are analyzing these tools is that what is the definition that they use in this case for environment? And this is the definition that we created for our tool in terms of what environment is for Colorado EnviroScreen. The physical environment such as nature, real environment, and pollution. But the tool do not include the social environment, occupational exposure, microorganisms, sanitation and hygiene, behavioral risk factors, or natural disasters. So as I mentioned before, the tool provides a final score. This is a composite score. This score combines factors like the health and social characteristics or pollution and climate reporting. In terms of the health and social, we have sensitive population indicators. We have 9 different health and age indicators. And in demographics, we have 6 different economic and race and ethnicity indicators. We have in the pollution, 9 environmental exposures going from air pollution, noise, and pollutants in the water. Environmental effects refers to those facilities and venues that are often associated with emissions of those pollutants. And also we have 4 climate indicators. So this is a full list of indicators that are included in this tool. And you see there's a variety of information included at different geographical scale. So just to give you a sense of the evolution of this project, similar to what the other presenters shared. So we started 1 year ago, and the first phase of this project was to actually ask community members and stakeholders if they need a tool like this, and if so, what kind of tool and what kind of information they want to see. Following that, we create a beta test of the tool. So we collect the data, clean the data, and then pull that in a map and an interface that they can play with and provide feedback about the user experience, the utility, the limitations, and how we can improve that. Finally, we launched the tool in June this year, and often how the indicators were selected. And here you can see we have several inclusion criteria. So we were focusing in data that was representative and relevant for stakeholders, but also that have accuracy, quality, consistency, and validity for the state of Colorado. And one of the important criteria here is also that capture different geographies in the state. This is the methods that we use to create the composite score. Individual indicators were grouped in subcategories of component scores, then were averaged and scaled up individually in two larger groups, then to create the final EnviroScreen score. So what you can see here is one of the results. So the map offers information at the county level, that is the primary legal division of the state of Colorado. So what you see, the different geographies here are the counties inside of the state of Colorado. Again, the colors provide a sense of more darker colors are those areas with more environmental injustices. The tool also provides the same information at the census tract level. The census tract level in the US refers to the geographical areas that includes less than 1,200 people. And the tool also offers the same map at this block group level that is between 600 and 3,000 people. So you have here a range of units. So most of the cities can even access their city boundaries and see themselves what is happening inside of the cities. So, and that could visualize and help to contrast what kind of neighborhoods are suffering more for environmental injustices. So the tool offers multiple interactive options. One is choosing the different locations or the different geographies that you want to visualize the scores, but also visualizing the complete score of the component or group scores, or even the individual layers of information. One example is that you can see at the same time the total score for the state of Colorado, or you want to see a specific air pollutant, PM 2.5, and even the concentration across the state. You can visualize any of those informations. And as I mentioned before, there are different histograms that offer the distribution of those, so you can visually identify where you are performing better and where you are performing worst. The tool also offers a table that you can visualize the numeric values of all the scores by geography, but also by indicator. And finally, you can download all the information directly from the tool in a table format, but also you can go and download the geographical layers information system. So what is the utility of this tool? As I mentioned before, this is a request from the Colorado Department of Public Health and Environment, Colorado State agency that is in charge to manage health issues, but also environmental issues. So the idea was to create one-stop shop to visualize environmental justice in the state of Colorado, to create an open data not only for the agencies, but also for any stakeholder and community leaders or organizations, provide a cumulative score for the whole concept of environmental injustices, but also for individual group scores and indicators. And we're in the phase of training different community members to use the tool. This is also used by other Colorado departments and agencies and the Environmental Justice Advisory Board for the state of Colorado to provide recommendations to the governor to perform and manage environmental injustices in the state, and also is used as one of the inclusion criteria to allocate funding across the state. So important limitations is that this tool only offers a perspective on environment, and this just shrink the variety of social determinants of health. From the environmental issues, we know that environmental risk factors connect with each individual organ and system in the human body, but this tool only includes a small selection of those that have that data is available and can be displayed in a map. So there's these two important limitations for considering and interpreting this tool. So what are the next steps in this process is to tweak and adapt this tool for the individual research projects, but also improve the tool based on priorities and needs that we see in the future coming for different entities, like a city level priorities and which kind of data is more useful, and even in terms of the geographical definitions. and of course, improving and adding new data sources and create more and scale up this tool to different locations. So thank you, and I will stop here and then allow other presenters to share their presentation. So Nimish, if you are ready, please start sharing your screen.
Okay. Just 1 second. I need to. Can you see the screen now?
Yes.
Okay, wonderful. Well, wonderful presentations. I guess I'll just try and do some justice to what everyone has actually presented, just presenting some ideas here. So I'm Dr. Nimish Biloria. I'm an associate professor at the University of Technology, Sydney. And the work that I'll be presenting actually spans my career, which was across the UK, the Netherlands, and now in Australia. The presentation is titled Smart Cities, Healthy Cities, but with a question mark, with therefore the idea of, well, questioning basically technocentric approaches to understanding the city itself from a population aging perspective. And I would just like to start with this particular slide in terms of understanding what well-being actually is and its subcategories in terms of the hedonic, eudaimonic, and social kind of constructs itself. Again, the idea of how the subcomponents of each one of these are actually, in some sense or the other, trying to achieve a sense of fulfillment for the everyday person, right? But the problem actually occurs when we look at the city itself, right? So in cities, it's almost imperative now that most things are unevenly distributed in space. And this implies to both entities and processes, right? Human populations and activities are also highly concentrated spatially. And this is something important for me because geography actually matters. And I think this is something which is a really important dimension of the presentation as well, including the fact that if you start looking at the World Economic Forum's kinds of suggestions in terms of how, even if you forget your genes, it's basically your zip code that influences. And even this particular graphic, which is coming from the World Economic Forum, does talk about this issue, right? When we look at income and therefore where you live, deprivations of green versus blue infrastructure, densification, insufficient space, the likelihood of spread of disease, I think, which is very relevant actually even in today's presentation. We've been seeing this all through as well. And of course, it was also felt immensely during the COVID-19 situation as well. So I think in some ways or the other, location basically is it excavates vulnerabilities. This is something which is really, really critical. And I think even if you look at what the key health risks related to urban planning decisions, which have been quite eminent actually now as we see other presentations as well. I think almost the top 10 causes of death were directly or indirectly related to urban planning decisions. And this is what World Health Organization also says. But I think this is especially concerning for the vulnerable aging population itself. I mean, even if you start looking at all the projections actually that are happening, right from the compositional change, to global aging perspectives, to the momentum of aging itself. I think this aging is something which is really, really critical and needs to be handled at an urgent basis. And essentially risk and sustainability become two growing concerns. But even if you start understanding determinants of urban health itself, also this whole list that circulates under the social kind of dimension, as well as the environmental dimension, I think it is impossible to separate it from the built environment, because this is where we actually operate, right? So aging is essentially spatial problem as well, according to me, and therefore social and situational characteristics which affect people's exposure to risk, access to services and specific types of adverse health events are also directly sort of connected with this issue. And therefore, it wouldn't be wrong to actually say that social structure is deeply spatially ordered, right? So these two terminologies are actually interlinked, and therefore they impact the manner in which people actually start perceiving health and aging itself. And this actually is not only limited to developing nations, including actually countries like Australia. Just looking at this graphic, I can actually tell you. So this is talking about Sydney's Great Divide, right? It's also sort of morally embedded within people that, oh, the people who live in the East versus the people who live in the West. Actually, there is a divide. And actually, this is not just in terms of their economic standing, but it's also very much evident in terms of every kind of determinant and every kind of health indicator that you actually start looking at. And everything actually stems from the manner in which space is actually structured, right? So right from child obesity rates to cardiovascular diseases to life expectancy levels, everything actually, everything is impacted in real time because of the manner in which you're geolocated. And within this context, actually, then comes the idea of, well, what is a smart city in this particular context? So I'm not talking about a technocentric kind of a vision around what smart cities are. For me, it's a very different kind of a construct, right? So the whole idea of an ecosystem of implemented solutions is what defines how smart a city or a community is. And actually what I mean by that is also in terms of understanding a transition that the generations of smart cities actually also have to go through, right from a technology kind of centric vision to something which is a much more human centric vision. And if you look at actually these development in parallel, if you compare it with the generations of well-being, actually well-being has also shifted quite a lot, right from a products oriented where everything was about a commodity that has to be sold to you, to a more context-based well-being oriented understanding. So I think those two dimensions of a human-centric vision and an overall vision of the context actually needs to be well integrated actually. But then how do we understand the urban within this context, which is like, it is a very complex issue, right? So, and this is where I would like to throw some ideas. I'm not talking about a particular project per se, but the whole idea of how geo AI and location intelligence coupled with this idea of people as sensors. So I'm not talking about people as a statistic. I'm just talking about people qualitative data input, but a little bit more than qualitative data input, which is connected with their physiological and maybe psychological state as well. And the whole idea of how do we twin this information in a process where we can simulate and analyze the urban itself. So I'm going to just talk about a quick walk through some of the projects. Actually, this was a project which was again connected with an EU funding actually that we had got, and was exhibited at New Horizons Festival, where we looked at this issue of technological democracy. So here we are looking at a particular area in Amsterdam, but the manner in which we wanted people to start inputting information was very crucial in this. So technology almost became a platform for participatory action rather than actually saying that, okay, let's start filling in forms. We said, well, filling in forms is good, but let's also start pointing geospatially where these places are. And therefore, we wanted to start panning around and looking around those places to understand what their physical makeup is about. This actually translated into another very interesting project that we did for the city of Sydney, which was here. Where we said, well, we want to take a different angle on understanding what heat actually does to people and how heat stress in the real sense of the word can actually be coupled together with from a both qualitative and quantitative dimension, right? So we were again looking at identifying hotspots of heat stress while actually maintaining physical diaries of these people who were actually traveling through the city in real time. So instead of saying, let's look at a geospatial perspective where we simply analyze this information coming from satellites, we said, no, let's look at lived experience of people on those cities. And then we sort of integrated this idea of, well, how each and every dot, which is actually now mapping this amount of heat stress that is actually being witnessed by people, is actually then intercepted with this idea of a 360-degree Google Street View imagery. Because for us, especially for me and my colleagues, as also as architects and public health guys, it was very important to understand the physical components of space which are actually making this occur, right? So this particular tool was then circulated to the city of Sydney, which was very interesting for them because they could then in real time try to understand the makeup which is actually creating this this kind of a setup. Another very interesting project that we did was so this is a recent project that we just finished in which we coupled the idea of Google Street View images specifically for 65 plus people. And here the idea was, well, how do we, I don't know why this bar is actually here, but how do we integrate machine learning models in order to start interpreting age friendliness of the city itself, right? So here but we didn't want to do it from a top-down technological focus. What we did was we made the machine learn inputs that are actually given by the 65 plus people of visual images. So it was purely perceptual and purely experiential of what those people actually felt about a particular place, at least in terms of, is it dingy, is it uneven surface conditions, is it too hot, is it devoid of tree canopy, does it have urban furniture, etc., etc. And so the machine learning algorithm was actually meant to learn inputs that are actually coming from these street view images. So people and machines were actually sort of combined together into one group to understand how a model can actually be generated. And this particular tool is now currently actually being circulated also to the New South Wales government. We are trying to actually figure out ways in which this particular tool could somehow become a measure so that customized kind of inputs can actually be created, because every particular place does not need similar kinds of solution sets as well. So places where we said, well, what are those places which actually require more kinds of community-oriented activities, more open spaces for exercising, more green cover, as opposed to very simple solutions in terms of also embedding signages on the floor level. Another interesting project we did was actually connected with again, the people perspective comes in here as well, where we're directly now getting into the physiological sort of mapping of people themselves. So this is where the people as sensors which actually comes in, where we are trying to understand urban stressors themselves, right? We're trying to understand, let's say, typically we are looking at A to B, that's what Google Maps actually gives you, but that does not maximize emotional gain. And this emotional gain is very important also for a healthy aging attribute itself. So then we were again looking at, well, shortest routes versus what happens where it actually passes through, what are POI densities that you can actually experience as you go through, how do we avoid areas which have heavy traffic, etc., etc. Yeah, so the idea is now, so this is a tool that we are currently communicating actually also with Microsoft, and there are some talks going on with Google as to how do we actually make something which is, let's say your physical attributes can actually become a manner in which you are actually able to navigate the city itself. So in some ways, you're also edging towards this idea of how let's say the elderly or the less kind of mobile people can also be actually benefiting from the maps themselves. And this was like a super cool project. Actually, this is something I always like to show. This is connected with an experiment we actually did together with Arup. Arup is a very big engineering company, and we were actually saying, well, what if we were to actually mimic the way just a house cleaning robot actually works? But the idea that actually how can people actuate places that they want for themselves, right? So the idea of vulnerabilities and how, let's say, even in Australia, actually, it's projected that almost 30% of the elderly will be without homes. And then the idea of, let's say, in remote spaces, is it possible to actually deploy shelters based on the kinds of user inputs or based on the kinds of requirements these people have? And this is a self-assembling kind of a system. So the engineering logic for this, including building that entire pod, has actually been already done. But after that point, I left the Netherlands and I joined Australia. So this is something which is still pending, and it's still on my mind that I really want to do something with this. On similar lines, actually on a smaller scale, because we're still talking about these ecologies of connections actually that can go through. This was another very interesting project that we did. It was a prototype. But the idea was that this particular, so you're looking at the compression and the expansion attributes of space itself, right? But the idea was the compression expansion is based upon how it can help regulate breathing itself and how it can help regulate meditative kind of attributes. So the idea here was to actually somehow start connecting your physiological sort of your biorhythms. And you have to imagine this structure as a big structure under which you are actually sitting or you're trying to meditate or standing there, right? And this whole idea of that breathing is actually able to control and regulate how the body rhythms can actually be articulated. So like today, I just wanted to give you like a glimpse of different attributes of, well, it is still smart, but we are still trying to understand this from the perspective of an empathic city itself, right? So the idea of, if you understand the city as an ecosystem itself, but how still do we connect it together in a loop which talks about the people, the context, the technology, and the economics that can actually underpin this situation. So therefore, like the whole notion of that, this talk was around how do we transition from thinking about cities as smart entities to thinking about cities as empathic entities, cities that can actually understand us, how technology and people can coexist. And therefore, there is a certain level of dependency, but at the same time, there's a certain level of givingness to each other as well. So this is where I would like to stop. Thank you.
Thank you, Nimish. And we are over time, so sorry for that, but I hope you have a vision about what individual presenter is working right now. And I allowed you and I encourage you to connect through the virtual platform and ask them questions if you have a specific question with them. So I think this is a fantastic overview what people is working across the planet. Thank you for sharing your projects. This is a fascinating work, and I hope to see you in the different sessions. So I will stop here. To continue, allow you to continue to the program. So thank you for joining this session, and see you around. Thank you for
Thank you.
excellent presentations.
Wonderful meeting
everyone.
everybody. Though. Exciting products, by the way.
Bye.
All right. Take care. Bye-bye.